Aloha, good afternoon. It is 2:36 p.m. on Wednesday, May 24th, 2023, and I call the Committee on Housing, Sustainability, and Health meeting to order. Welcome to Vice Chair Kia Aina, Committee members Okimoto, Dos Santos Tam, and also Council Member Floor Leader Cordero. Before we start our meeting, I have some procedural announcements to make. I'll note that Councilmember Toba is also present. Pursuant to HRS Section 92-3.7, this meeting will be conducted as a remote meeting by interactive conference technology with the following procedures in effect for the meeting. Members of the public will be allowed to provide oral testimony on all items on the agenda when each agenda item is taken up in two ways, remotely and in person in the council chamber. Persons who have registered to testify in person will be called upon first, followed by those who registered to testify remotely. Persons who have not registered will be given an opportunity to testify following the registered testifiers. Before testifying, each person shall state their full name. Each person will be limited to a 1-minute presentation per item. HRS Section 92-3.7 requires all votes at remote meetings to be conducted by roll call unless unanimous. Therefore, if any objections are noted, I will call for a roll call vote. Written testimonies, including the testifier's address, email address, and phone number, may be posted by the city clerk and available to the public as described on the posted agenda. As a courtesy, please turn off all cell phones for the duration of this meeting. Now turning to agenda item number 1 for action, resolution 23-95, accepting a gift valued at $3,825.05 from Re-Earth Initiative for the Office of Climate Change, Sustainability, and Resiliency Climate Change Adaptation Specialist to attend the 2023 United Nations Framework Convention on Climate Change subsidiary body meetings and youth forum in Bonn, Germany. How exciting. I believe we have no registered speakers on this. We do have Director Gonser present. I don't know if you had any insight or thoughts. You could tell us a little bit about this item as well.
Sure. Aloha. Good afternoon. Matt Gonser, Executive Director for the City's Office of Climate Change, Sustainability, and Resiliency. Thank you for your consideration of this unique opportunity for one of our staff members to join. We don't often have a chance to join these international global discussions. This partly stems from a youth group that she was active in before joining the city, and they've seen the opportunity to think about how to support more municipal participation in some of these discussions. And we would greatly appreciate your consideration of this gift for her opportunity to observe these kinds of deliberations, but also bring back important lessons for how we can continue to include youth in our discussions here through all the council's work and engaging with the Youth Commission. Happy to take any questions.
Mahalo for that, Director. Do we have any questions for Director Gonser? Sensing none, mahalo. With no registered testifiers, I just asked, do we have any other testifiers in person or online?
Chair, there are none.
Thank you, Madam Clerk. Members, any discussion before I make my recommendation on this item? Sensing none, the Chair recommends that Resolution 23-95 be reported out for adoption. Is there any discussion, objections, or reservations? Seeing none, so ordered. Okay, and then now moving on to action item number 2, Resolution 23-70. I believe this is Councilmember Cordero's resolution. Would you like me to turn it over to you for explanation?
Thank you, Chair. I was pleased to introduce this, pleased but also gutted that we have to introduce this in support of the Board of Water Supply with my colleague, Councilmember Akino Okimoto, excuse me. And as Red Hill is in my council district, I do appreciate that the BWS not only presented to the council members, but myself as well. And this resolution really just hopefully helps to urge the Secretary of Defense to provide for PFAS information that has been requested by the Board of Water Supply as from the beginning of this year. And I also want to say that I have a proposed CD1, which is mainly technical. This just adds the full Exhibit A to the rest of the resolution. I just wanted to get ahead of that before anything. So I hope that the committee does approve not only the proposed CD1, but also the resolution as well. And the resolution, of course, provides a pretty great timeline of the occurrences of the events, but I want to kick it over to my colleague, Councilmember Okimoto, as well.
Thank you, Florida. Thank you, Chair. I agree. I'm grateful that we're able to co-introduce this. I did have a question. I'm not sure when is the appropriate time, just to kind of follow up on the purpose of the resolution. So I think appropriate time is now. Okay.
Just to clarify, did you have a question for Director Lau?
Yeah,
Or-
for the
okay.
Board of Water. Yes.
Okay.
Thank you.
Perfect. Yeah, we can go to that now. I would defer to you folks. I just note, as Councilmember Kodara mentioned, the CD1 is OCS 2023. Dated 4/27/2023 at 11:03 a.m. That is posted on the agenda, the summary of amendments. Director Lau, Chief Engineer Lau, if you'd like to come up.
Thank you, Chair. Aloha, Director Lau.
Aloha, Chair members. Ernie Lau, Manager and Chief Engineer for the Board of Water Supply. I also have with me my Deputy Manager, Erin Kawata, should you ask really hard technical questions. But I'm available for any questions. But before I start, if I could say that we strongly support this resolution. And we much mahalo to Councilmember Cordero and Councilmember Okimoto for introducing this. I'd like to commend the Honolulu City Council because of all the elected bodies or elected leaders of our state, this city council since 2014, and the recap or the chronology of now, this will be the 7th resolution supporting the Board of Water Supply in our community to keep our water safe, to protect our water resources. This council has been there from 2014, so a big mahalo, and I commend you all for your efforts. I'm available for questions now.
Thank you, Director Lau, and I'm grateful to be here. I know when I started this journey with you, it was actually at the building across the street, and so glad to continue now with my colleagues here. I think it's a simple question because the resolution, the purpose of it was to follow up. So I wanted to know if the Secretary of Defense has responded to the letter that was dated January 10, 2023, and if you could give an update of the status of that.
Thank you. We have actually received no formal response from the Secretary of Defense, but I am glad to report that they have actually reached out to meet with us in virtual meetings, I think now maybe 3 times. We are talking to 2 Assistant Secretaries of Defense, and they are still pressing them for a timeline or when they're going to present all the documents that we requested. I'd like to also acknowledge, too, that the Assistant Secretary of the U.S. Navy is now in direct discussions with us about our request, including access to Navy wells, which they now, for the very first time, seem to be willing. I am hopeful that they will actually follow through and allow us to take samples out of Red Hill Shaft and other Navy monitor wells.
Thank you, Director Lau, and I just want to thank you again, and we're going to still work together. I appreciate all the passion, and I know this has been something just you've been really diligent about, and I know your heart is in this process and making sure that we address this concern. So thank you for all that you're doing. Hopefully we can continue to move forward together and be able to answer and resolve the many wrongs that have occurred because of the Red Hill fuel tank storage facility and how it's affected the health of our residents here. But thank you so much. Thank you, Chair.
Thank you, Councilmember Okimoto. Any other questions or thoughts for Chief Engineer? No? Okay. Mahalo. Okay, also welcoming Councilmember Say to the chamber. Let's see. Now, go to testimony. Clerks, do we have any in-person registered testifiers for this item?
Chair, there are none.
Okay. And Do we have none for remote? Yeah. And then I don't believe we have any remote testifiers either. Is that correct?
Chair, there are none.
Okay. Any unregistered testifiers present today in the chamber or anyone online wishing to opine on this matter? Seeing none, members, we are in discussion. Any discussion before I make my recommendation? Back to Councilmember Cordero.
Thank you. First up, I think that this is timely. I do want to also note that my state senator has also has provided a letter in support of BWS's efforts, and I believe that as a council, passing this resolution is a stronger message so that we can further support the Board of Water Supply in receiving those key documents as it relates to HFF, PFAS, and also retaining information from the water shafts as needed from the Navy. And yes, thank you.
I appreciate that. Any further discussion? Seeing none, the chair recommends that Resolution 23-70 be amended to the posted CD1. Any discussion, objections, reservations? Seeing none, so ordered. Resolution 23-70 is amended. The chair then recommends that Resolution 23-70 CD1 be reported out for adoption. Any discussion on that matter? Seeing none, any objections or reservations? Hearing none, so ordered. Moving to agenda item number 3 for action, Bill 28, promoting public health, safety, and welfare by enhancing access to naloxone hydrochloride. At this time, I'll defer to the introducer of the bill, Councilmember Dos Santos Tam.
Thank you, Chair, for hearing this very important measure. You know, as we've seen all around the country, the scourge of opioids and specifically things like fentanyl. And we are not immune here in Hawaii. And in fact, over the past year, as Director Ireland, who I think was the designated speaker for this, will attest, I mean, their EMS folks see overdoses literally left and right. It was reported at one of my neighborhood boards that HPD, that now carries Narcan, was able to revive somebody who had overdosed in the community. And many of our bars and restaurants, as you may have seen on Hawaii News Now this past week, have started keeping it in stock. And so we're taking a proactive measure here to get ahead of this crisis with this bill that would mandate naloxone, that is Narcan, to be in bars and restaurants, basically places where alcohol is served on premises. We know that both opioids and alcohol are central nervous system depressors, and they can sometimes interact with very negative consequences. We'd be the first jurisdiction in the country to mandate this. Many other cities have provided it for free to their bars and restaurants, and we're hoping to do so here as well through the work of the Department of Health and the Liquor Commission, as well as community partners like H3RC.
Mahalo for that explanation, Councilmember. I see Deputy Director for Emergency Services. If you'd like to come up, I'm assuming you're the designated speaker today. I don't see Dr. Ireland present.
My bad. Now
Good catch. No, good catch.
I was like, hey. Again, thank you, Chair. On behalf of Deputy Director, on behalf of Director Ireland, I am here to speak and answer any questions of it needed for the committee. Again, Ian Santi, Deputy Director, Emergency Services Department. We support the bill. We feel that there is a lot of good that can come of it. And as the council members pointed out, we do see overdoses on a daily basis. And fentanyl is on the rise on the mainland, as well as other narcotics. So we are definitely in support of it. I think there's some challenges that need to be worked out within the bill, but we're available for some questioning.
Okay. Mahalo, Deputy Director. I'll go to first Vice Chair Kia Aina, and I don't know if anyone else, Councilmember Okimoto after that.
Good afternoon. Just so that I clearly understand the need for this, but I'm just trying to wrap my head around the issue and implementation, right? So if you don't mind. So first off, can you describe where are opiate overdoses most often occurring on Oahu? Is it at businesses with restaurant, dispensaries, cabarets, brew pub licenses?
As a paramedic with the city for 25 years and my first 15 years as a practicing paramedic on the streets and serving the urban core metropolitan area, I can say with certainty that we have overdoses on the entire island. And it doesn't matter the area, the location, it just matters and they're able to get access to these drugs. It happens in people's homes, it happens in shopping malls, it happens in bars and pubs, it happens everywhere. It doesn't happen as much frequency in those places, but it happens everywhere.
Okay, thank you for that. I'm trying to understand the connection between businesses with certain liquor licenses and the need then, because the bill covers just certain businesses. Do you concur that that's a good place to start then?
You can't require somebody, I mean, I don't think you could require somebody to have it in their home, so I would think that that is one option. I believe the liquor administrator is here, so maybe she can answer some questions related to that, or would that be okay?
Good afternoon, Committee Chair, Committee Vice Chair, and members. I'm Anna Hirai, Honolulu Liquor Commission. Yes, we did have the opportunity to work with Councilmember Dos Santos Tam on a language involving this requirement and this product, and that's why, probably because we are fresh off the experience with COVID, where the descriptors were bars, nightclubs, and restaurants, that caused a great deal of confusion. So we suggested, and he adopted, the very specific HRS class descriptors from our liquor laws, and that way it is absolutely clear who is covered by this. And they're all on-premise consumption licensees. We did not include, I think the only on-premise consumption licensee not included is hotels, but virtually all of them have
Okay,
been
so
covered.
you agree that although it's happening everywhere, that this is a good start?
It seemed like a logical place to start. These are recreational licensees where alcohol consumption is taking place. We didn't carve out the ones that have the standard and therefore no live entertainment and the ones that did offer live entertainment, but this was certainly a good bright line definition of the premises that should be covered.
Okay, thank you so much. For the Deputy Director, how many opiate overdoses occurred in 2022?
I don't have the exact data in front of me, but I can definitely get that back to you. But what I can tell you from the data that we do, we give about over 1,000 doses of Narcan annually. And the 1,000 doses of Narcan that we give annually are related to all the criteria of the individuals that fit the criteria of an unconscious person. So we try to rule out an opioid use. And I can try and get back to you some more specific data.
Thank you. And on the data, could you break it down into overdoses that resulted in death versus those that did not result in death?
I believe the medical examiner has that, so we can definitely get that for you.
Okay, thank you so much. How many businesses would be required to carry naloxone? Is that what it's called?
Naloxone or Narcan, whichever.
Okay, Narcan, if this measure passes.
Okay, thank you again. Based upon the identified classes, currently we have a total of 1,471 licensees. This would cover approximately 854 licensees, or 58% of our licensee population.
Okay, thank you for that. Where would businesses acquire this?
There are various places right now working through the Department of Health and H3RC. You can get it for free. An individual today can jump online and go to a website and sign up and get a Narcan delivered to them.
Oh.
The FDA recently released that they're going to be doing it over the counter through the pharmacies, so that is going to be a cost. But as of today, right now, I don't have that information in front of me specifically about what the website is, but it is through the H3RC website and it is on their homepage.
Okay, so there would be sufficient supply for businesses to comply?
I believe so, yes.
Okay, I understand that Hawaii will receive $78 million from settlements with pharmaceutical companies to combat Hawaii's opioid epidemic. An advisory committee of county and state reps will decide how to spend most of it, but 15% was left to the counties to determine how to spend. Do we know how much of the $78 million will go to help with this issue?
No, I do not. I believe all of it is supposed to be directed. You're talking about the specific issue for in the bars and restaurants, and I do not have an answer for you that. And we can check with the state advisory committee to see how they would be approachable.
And then with regard to, again, implementation, would businesses be subject to pay for this out-of-pocket?
There's the opportunity to get it for free now, so I would encourage anybody to go and get it for free now, but I would have to defer to the Liquor Commission they would have to pay for it?
And how would businesses determine if a person is in need?
Okay, I can answer that question. What the number one thing that we tell everybody, before you even use Narcan, the main thing is to identify that the person is unconscious, call 911 and initiate CPR. Giving the miracle drug, what is deemed as Narcan, doesn't necessarily help in every situation. The best thing that everybody can do is bystander CPR and calling 911. After that is initiated and an AED is brought to the individual, then the administration of Narcan can happen. So it is a benign, in that particular situation, it's not gonna make the situation worse by them administering the Narcan to an unconscious person.
Okay, so this is, maybe relates to this. So is it dangerous for someone to administer Narcan if a person is not having an opioid overdose?
No.
Okay. And then lastly, on training, who would conduct the training for the business managers and who would pay for this training?
There is a lot of free training, again, with H3RC. The Department of Health collaborates with them, so there are a lot of communities out there that can provide the training. The training can be done in briefly as less than 15 minutes. There's step-by-step instructions that are that come with the Narcan. So there are a lot of resources out there available to conduct the training. And again, as of today, if they get it, then I understand it's free.
And then at the establishments, with regard to who would administer, would you recommend only managers or would they train their employees?
It would be the best interest that we talk about CPR. Early access, early CPR, early defibrillation are the main key points. If we get training in being able to call and recognize that somebody is unconscious, then any person can be able to administer the Narcan. But recognition of a life-threatening situation is the most important first.
Okay, thank you. Thank you for your answers.
Thank you, Vice Chair. Councilmember Okimoto.
Thank you, Chair. Thank you, Vice Chair Kiana. She actually asked most of my questions, but I did want to follow up on some things that were on my list and kind of in coordination with what Councilmember Vice Chair Kiana mentioned. And I want to thank the introducer of this measure because I understand that we are really in, and you've expressed the dire situation that occurs, and anyone who knows or had a loved one that passed away because of this, this is definitely a life-saving medicine. But I do believe that we need to be taking proactive measures to combat this, especially as this drug rises, the incidence of overdoses rise. I just have a few concerns about the mandates, and that's where most of my questions come from. I did want to tag on because, like I said, Vice Chair Kiana mentioned most of the things that I had on my list. If I could also receive the statistics on where...
We'll make sure it gets to the committee chair, and then he can distribute if that's okay with everybody.
That would be great, because I did wonder, when I'm watching the news, I wasn't sure why we're mandating it specifically in these establishments versus elsewhere, so that would be really helpful. And like I mentioned, my concern is that we're mandating this in specific places like nightclubs, while perhaps this medicine we might best provide it to everyone, or specific areas where we have more statistics on in these situations, in these locations, that we have more incidences of opioid overdoses that lead to death. What are your thoughts on that? Or also even how we could focus our supply outreach outside where it's needed the most, homeless shelters. Maybe if you could, I know you said you could get us data, but could you give us at least an idea of where you guys are responding to these calls most?
No, definitely. And again, like I said, my first 15 years of my career as a practicing paramedic, I responded in a nightclub, I responded outside of a nightclub, I responded in a homeless shelter, right outside the homeless shelter. So wherever you do put this, wherever the place it is, it will make a difference and it will be benefit to the community. I cannot say with, like you said, why are we starting here? I think the council member and the Liquor Commission had a good conversation about that, but I think it is a good place to start because we have to pick and start someplace. We'll provide you the data, but our overdoses that we see in the community, we see them at people's houses. We see them doing fentanyl inside Hawaii Kai and Kailua all over the entire island. I mean, we can go to every part of the island. We've been carrying Narcan for many years on our ambulance, well before anybody else. And what it again is the opportunity for over-the-counter Narcan and public administration of Narcan definitely allows for the community to be more involved. So preventative, I totally agree. As Councilmember Kaihana pointed out that, the state received opioid money and they're doing education, hopefully to tell people about the dangers of these drugs. So continuing that and working with the state, I think is a good partnership and moving forward. So anywhere we get it is, I think, is a first step.
Thank you. I completely agree. Just getting education even down to we have DARE at the schools that I
Yes.
taught at, so that's really important. You mentioned training. I kind of wanted to get more information on how the training would work. So are we mandating it to every employee in these establishments?
I am not quite clear on that. I would defer maybe to the Liquor Commission. You could, no? It's not mandated. It's just that they have to have it, right?
Yeah, there has to be some
We,
identified.
So as
I can loop in Councilmember Dos Santos Tan
Okay.
as the
Maybe a
drafter.
different way of asking that would be to the acting administrator. If you could talk about the blue card that is a manager and when a manager is required to be on site, and then also what sorts of other trainings that a manager has versus, or is required to have as part of this process versus just a bartender or bouncer.
And then we'll go
No,
back
all
to
of these,
Councilmember.
all of these on-premise consumption licenses are required when they're open for business and customers are on the premises to have a registered manager on duty. Those managers come to the Liquor Commission and take very specific server training, liquor laws and rules, compliance from us, and take an examination. That I think the duration of a valid blue card is for 4 years. So there's always going to be on a premise, and most of these, most establishments don't have just one blue card holder because that one person can't be expected to be there 24/7, 7 days a week, so on and so forth. So there will always be someone on these types of premises that will be on premises and will be a registered blue card holder with this. That was a good way to identify our response. We use this actually for liquor laws compliance. Investigators go on the premises. One of the things that they will always ask for is to talk to the manager on duty.
Okay, thank you. Thank you, Councilmember Dos Santos Tam. I had a question about, you mentioned, I want to ask about the enforcement of this because on page 3 of the bill, it talks about, is it the Liquor Commission that's going to be the enforcing agency? Who is going to be the enforcing agency of this?
The way that the Bill 28 was drafted was specifically to be expressed that Liquor Commission would be a secondary enforcement because this will become an ordinance, if made into law, become an ordinance. We administer the HRS Chapter 281 and our local rules. How this has worked in other circumstances, and I'll give an example of, let's say, violations of assembly permits or fire codes, is that another agency with jurisdiction over that activity will issue a violation against one of our licensees for failing to comply with the assembly permit requirements. They'll refer it to us, then we'll bring it in an administrative proceeding before our commission with a licensee under HRS 28138.
So if you're the secondary enforcement agency, are you aware of who's the primary?
I'll tell you who I assumed it was going to be, and even though this is probably going to make me unpopular with that department, but I thought it would be HPD, to be honest.
And is HPD aware of that?
I don't know.
You don't know? Okay. Okay, thank you. I did have a couple more questions, if that's okay, Chair. And again, I'm not sure who to direct the questions to. I'll put it out there and hopefully somebody can answer. We talked about the funds. So right now there are funds to pay for the medicine. And you, Deputy Director Williams, you really encourage those to go get it while it's free. But what happens when it's no longer, the funds are no longer there and we have a mandate? Is it the establishment who now has to go and pay for the medicine?
I don't have an answer for you on that. Again, that's why, again, we encourage it because it's for free now, and we don't know how long the funds will last, but DOH is working with H3RC and other organizations that they are giving out the free Narcan, and any individual right now can get it. And when you do get it today, it does last for at least 2 years.
2 years, that's also good to
expiration,
know. Okay,
Oh, they have a good long.
Yeah, they have a long expiration.
Okay.
yeah.
Because I can talk about, so I'll just sort of interrupt here. So we were, the 4 county liquor control departments were contacted by the chief of Community and Crime Prevention Branch, Crime Prevention and Justice Assistance Division of AG's office, and said that through the Department of Health, Alcohol and Drug Abuse Division, they're going to make available enough, all we had to do is place an order for 2 cans per licensee, however many licensees we want, and this product would be delivered to us for free. That happened they overnighted that product to us. However, because Department of Health said that they were going to be responsible for developing the training media for this, we're not distributing it yet. We're just holding it. So I was glad to hear that they have a long shelf life, because I was kind of worried about that.
but do you have concerns that, I mean, again, with running a business, now you have to ensure that somebody's watching. Even with my vitamins sometimes at home, I don't pay attention to when the expiration date happens.
Correct. Yeah,
Right.
and just like anything, I would think that there would be a protocol in place in the organization, like you check your fire extinguisher, like you check your AED. And just a side note on the training, just like any one of us has had nasal spray in our nose, that's as simple as it is. In the container, in the box, comes 2 doses of Narcan, 4 milligrams each. You open the box, it has instructions how to do it, but really it's as simple as taking it out, putting it in your nostril, pressing a button, and you're done. That's how simple it is. So it's a mist, it's less than a 0.cc of a mist, and that is all the training takes. Again, in a stressful situation, like I said, the most important thing is getting the community, getting the person to call 911, activating EMS, getting our services there, but also providing bystander CPR if needed at that point.
Thank you. Thank you. Thank you, Chair.
Thank you, Councilmember. Also recognize the presence of Council Chair Waters. Deputy Director, I'll continue on with you if I may.
No problem.
So appreciate the insight. So I know Administrator Harai mentioned that they have the Narcan, we'll call it, no instructions. Do we know if HESD can supplement the instructions to go with the Narcan so they can start distributing?
We definitely can work with the Liquor Commission to help them figure out how they want to roll it out. I don't see a problem with that. Again, like I said, I think they're looking for a training media that they can probably give out to their individual agencies that they're working with, so we can work with them, and that will take us some time to put something together. But as I said earlier, the instructions are in the box, and we can make something happen for that.
Okay, don't go too far, but I'll just ask
Yeah.
Administrator if she can add. So is that a restriction from DOH? They said, oh, hold off, we'll give you some instructions.
Yes. So if there's other training media that's made available that they approve, and we are told that they approve, that we would be free to release that.
Okay, appreciate that, because I understand what Deputy Director Santi is saying. Instructions come in the box, but then sounds like DOH is saying, oh, hold off on distributing until there's additional materials.
Although I think it's going to be just more it's not going to be a video or anything like that. I think it's just going to, maybe it's a laminated card. I don't really know, but it didn't sound like it was going to be something complicated like
Video.
like a video. It was going to
Okay.
be just, I don't know, maybe something like what you get on an airplane.
Okay.
You know,
Like a pictograph.
Okay, infographic type thing.
There you go.
Yeah, okay, that's good, just checking in. So just to make sure, sounds like I'm hearing that as we're waiting on DOH, if there's any timing issues, HESD can help possibly develop instructions to make sure we can start distributing, is that correct?
Yeah.
Oh, awesome.
Yeah.
Oh, easy. Thank you. And then I was gonna ask, who, in terms of the city, and this will be for Deputy Director Santi and the administration, carries and is trained to use Narcan?
Emergency medical services, 911 ambulances, we've had Narcan ever since we've been around. The Honolulu Fire Department does have Narcan on their fire apparatuses. The Honolulu Police Department has Narcan with their individual officers, and other agencies that work with special populations, we've done training with them and have gotten them Narcan also.
Can you just give examples when you say special populations?
Department of Community Services that do outreach. That would be elderly, they deal with the homeless, those type of situations.
Okay, I appreciate that insight. Because I understand, some of the concerns, particularly Councilmember Okimoto's concerns. We want to just evaluate, make sure that we're not placing undue burden on businesses first, and then for me, I think it's also making sure that the city is putting its, foot forward first also, right? Anything we're going to be requiring of others, we should be contemplating for ourselves, whether that's recycling, rooftop solar. In this case, understanding the Narcan epidemic that's upon us, wanted to make sure, right? Because I know we have folks, dealing with homelessness at our parks, for example. So I'm wondering has there been a conversation amongst the administration whether, every city facility should have Narcan available as a part of, our other medical supplies that we see, or?
We can definitely look into that. I don't believe every agency within the city has had that conversation. Again, we focus primarily on our first responders and the people that do directly community outreach, but definitely you bring up a good point, Chair, and we can definitely talk to other departments about who should get, if the Narcan availability is available to them and the training also.
Okay, appreciate that. Because a lot of the concerns that I shared, or mentioned earlier, were laid talking to administrator and other folks, understanding the cost is pretty minimal.
Yes.
For even if it was borne by the business, and then right now we have this surplus of free supplies. So appreciate that. I'll go back to administrator real quick. Appreciate that, Deputy Director. I don't think I'll have any other questions. Yeah, I just wanted to clarify. So in your understanding and reading of the ordinance or proposed bill, rather, is it correct that some folks are included in this that don't necessarily serve alcohol on the premises, particularly those that may be classified as small craft producer or having a pub license, or would everyone in that classification have alcohol on the premises?
Well, by making it onto the Bill 28 list means you are a on-premise consumption. I know a producer pub or brew pub implies it's a but the brew pub and the small craft producer pub are two hybrid super licenses where you conduct multiple activities. You can manufacture and you can have on-premise consumption.
Okay, so in your experience, do all folks that have this license participate in the full extent of what's allowed in terms of they allow consumption on property, or some folks may have this and just do the manufacturing?
It would not make much sense, actually, to get a brew pub or small craft producer pub license unless you wanted to have on-premise consumption. If you were just a beer manufacturer or a spirits manufacturer, the only thing you could do would be to have a tasting room. So you would not, because there's quite a cost differential in terms of the annual license fee and your percentage that you're paying on your gross liquor sales between manufacturer and small craft producer pub, because you adjust upwards for those extra activities.
Okay, Mahalo, appreciate that information. Any other questions? Councilman Vice Chair Kiaina, and then Councilmember Say.
Just a quick question with regard to who carries. Our HPD officers, do they carry Narcan?
Yes, ma'am. They do. They do.
Really?
Yes.
Okay, wow, I'm impressed.
Yeah, so again, HPD, the Public Safety, HPD, Honolulu Police Department, Honolulu Fire Department, Emergency Medical Services, those three main first responders do carry Narcan at this time.
Thank you.
Councilmember Say.
Chair, I don't know who to address it to, but maybe you could help me, Deputy Director. It's just the question of the protection from liability, which is HRS 663-1.5A.
I would,
I would have thought that you would have to get the approval from the state legislature first before we are protected from, lawsuits.
I would venture to say, not 100%, but I would look at the cause of it. Again, we have the Public Good Samaritan law when we're trying to help people. So again, as I've said earlier, calling 911 and initiating CPR, an individual that has received that training, there's the Good Samaritan law that helps protect them.
Okay.
So it would be my understanding that would be the same part for this also.
Okay, one final question too. And the question is just a question for me about if I'm not overdosed or anything, but then somebody does it to me, is that okay?
One more time, I'm sorry, council member. You said if you're overdosed on anything and we give that to you, is that okay? Yes.
It's not going to affect my
No.
well-being?
And just again, as I pointed out, we've had over 1,000 uses of Narcan on our ambulance in the last in a year. And usually, what happens is those are for cases that are unconscious, and you can be unconscious from a crystal meth overdose. You can be unconscious from a Valium and other drugs that cause you unconscious. But again, our protocol is that when somebody is unconscious, we do give the Narcan. Fentanyl and opioids are downers. It allows you to kind of just relax and go unconscious, and it affects your breathing. So it is a true life-saving drug because, again, by getting that reversal effect there, it helps to initiate and help you start your breathing again. But it is the most important thing to call 911 and initiate CPR first before doing that.
No, it's just a question, Deputy Director, if the high school student gets Narcan and just uses it as a prank, as a nasal spray, is there any side effect to it? No?
To my knowledge at this point, it's not. I would think it's as any side effect that would happen as you rapidly shove anything up somebody's nose as a spray.
Okay, I'll trust you. Thank you.
Thank you, sir.
Okay, if there are no further questions, we'll go to testimony. See no other questions. First to remote testimony, we have 2 registered speakers. First, Heather Lusk, and then Rebecca Soon. Heather, please proceed if you're on.
Yes, hello. Sorry, it took me a moment to unmute. Aloha, my name is Heather Lusk with the Hawaii Health and Harm Reduction Center, also known as H3RC. Really appreciate the opportunity to provide testimony and strong support of this measure. H3RC has been the primary agency that has distributed naloxone over 50,000 doses since Governor Ige signed Act 68 in 2017, which does provide full immunity to anybody in the state that administers naloxone. As you heard from previously, it's a very safe drug. If you have no opioids in your system, it cannot hurt you. We are alarmed about the increase in overdoses, particularly within the nightclub sector. Understand that there's concerns about mandate, and I can say as a community-based agency that's been doing this for the past 7 years, we are more than willing to provide training. We have one already on our website that people can access 24 hours a day. We're happy to provide handouts or anything that any of the establishments may need in order to make this as painless as possible. But to get this into the clubs, whether it's in their AED or elsewhere, in order, because of the 2 instances I was aware of in nightclubs, 1 person was saved because naloxone was on site. And that's all that we want to do is get this amazing life-saving drug that the FDA has now made over the counter because it's so safe into the establishments where we're now seeing people with whether it's counterfeit pills that have fentanyl or other opioids. So thank you for the opportunity to testify in support of this bill. And again, really want to support any of the establishments or anybody interested in naloxone in getting access, getting training, and getting the education they need. Thank you.
Mahalo, Heather. Appreciate all the work that you're doing. Any questions for the testifier? Okay, seeing none, thank you again for again the work you're doing in testifying today. We'll now go to Rebecca Soon.
Chair, testifier isn't present.
Is not. Okay. Madam Clerk, are there any other unregistered remote testifiers?
Chair, there are none.
Okay, thank you, Madam Clerk. Going to in-person testimony, I don't see any registered testifiers. If anyone is present in the gallery, please come forward and identify yourself and proceed while turning on the microphone as well.
Aloha Chair, Vice Chair, and the committee. Angela Melody Young testifying on behalf of Kapalama Neighborhood Security Walk. And in support, so Narcan is a medication approved by the Food and Drug Administration, FDA, designed to rapidly reverse opiate overdose. It is an opiate antagonist, meaning that it binds to opiate receptors and can reverse and block the effects of other opiates such as heroin, oxycodone, and morphine. So the question I like to present is, could this medication be more effective if it were provided by those who work with homeless persons? To clarify whether or not there are more occurrences in the chronically homeless population or the clubs and bars, I think you'd have to check with the prosecuting attorney who commented during the budget hearing about drug overdoses and drug-related offenses, as this is a matter of criminal law. AG also practices criminal law and can provide an accurate reflection of number of deaths and criminal offenses, while the emergency medical departments can provide an accurate reflection of overdoses. I think, yeah, so thank you.
Any questions for the testifier? Seeing none, thank you, Ms. Young. Is there anyone else wishing to testify today in the gallery? Seeing none, members, is there any discussion before I make my recommendation? Councilmember Dos Santos, 10.
Thank you. I want to commend you as chair for having a hearing on this, as well as to my colleagues for their very good questions. Again, this is an opportunity for us to get ahead of this crisis that is affecting people all around the country. And specifically, I think to some of the discussion here, we're starting with bars, nightclubs, places where alcohol is served on premises, because this is about risk. As Deputy Director Santi mentioned, opioids are everywhere in every community, but there's a much higher risk of a negative interaction between alcohol, which depresses your central nervous system, and an opioid drug, which does the same thing. And together, that can create a really negative outcome. It would be great to see this in many other venues, but we have the ability to narrowly prescribe the types of venues. We have managers who already have training in different areas. And so, this is a really easy, logical way to start. But if anyone out there is watching, I'd encourage and interested in getting this for their own business or for somebody that they know. There's lots of organizations out there that will provide this. But I think by starting in bars, nightclubs, and other places where alcohol is served, we can really minimize risk. I'd also note that it goes into effect January 1st of 2024 to give time to work some of these things out and also hopefully be able to tap into the opioid settlement money.
I'm just ask a follow-up question on that. What is the time frame needed to tap into the settlement money, and could you explain a little bit more about that?
I don't think it's a matter of the money being available. I think it's just the process for how we would, ask for a grant out of that or work with the Department of Health or some other agency. So, it'll take some time to work through the process there. But in the meantime, groups like H3RC, Department of Health, and others are providing it, for free. But hopefully we can have some sort of ongoing mechanism.
Okay, appreciate that. Councilmember Okimoto.
Thank you, Chair. I want to, again, just express my appreciation to the introducer of the bill, especially as it pertains to what we can do to save the lives and keep our community members safe. This opioid epidemic is something that's plaguing our communities right now. I do still have concerns and questions with the mandate that will be placed on these establishments. Well, you mentioned also, what kind of, is it going to be an unnecessary burden placed on them? So I think for me, I would suggest that perhaps we can establish a hub for this medicine where establishments can pick up the product on their own, or also encourage, like I mentioned earlier, educating and continuing to provide proper education and supplying the community on this life-saving medicine rather than just mandating it to places that to have them. We still don't have all the information on that. To me, it makes more sense to have it readily accessible for anyone who wants this product in their establishment versus just pinpointing this and having a mandate placed in. So these points, along with the fact that we still have unknown factors, some questions that weren't clearly answered of the primary enforcement agency, does the police department know that they're assumed to take on this responsibility? And if it's not them, then who? And other questions, we're not sure about when the funding will lapse and who will be responsible to pretty much foot the bill. You did mention that it would be a minimal fee, but again, I would like to have those things clarified. So there's a bunch of concerns, not the intent of the bill in any way, but just some loose ends that I would like to have clarified. So for those reasons, Chair, at this point, I'll be voting with reservations on the current bill. Thank you.
Understood and appreciate that. Any additional thoughts? So appreciate all the input. Before making the official recommendation, just note that I will be, recommending that it go out of committee, understanding it'll come back. We'll continue to monitor testimony and do outreach similar to Councilmember Okimoto. We have made some contacts in the community, but I'm glad and excited to see that all the testimony so far has been in support, and to see all the great work that's going on in the community, particularly with H3RC. And so the chair is going to recommend that Bill 28 be reported out on second reading, scheduling of a public hearing, noting the reservations of Councilmember Okimoto. Was there any additional discussion, objections, or reservations? Okay, hearing none, so ordered. Mahalo. And now moving to action item number 4 for action. Bill 4, relating to the adoption of the State Energy Conservation Code. Members, please note that we have posted to the agenda the CD1 OCS 2023-130/2/22/2023, 1:39 p.m. that was approved by the Committee on Housing, Sustainability, and Health at its meeting on March 1st, 2023, and subsequently postponed in committee. We also have posted to the agenda proposed CD1 OCS 2023-443, 5/18/2023, 2:52 p.m. to the bill. For your information, the summary of amendments is listed on the agenda. I know we have from the administration, Director of DPP, Apuna, and Director of CCSR, Matt Gonser. Members, do you have any questions for the directors? I may ask Director Gonser to come up and just provide an update or overview, and I'll defer. Welcome, Director Apuna, but I'll leave that up to you in your discretion. Yeah.
Aloha again. Good afternoon. Matt Gonser, Executive Director for the Office of Climate Change, Sustainability, and Resiliency, and thank you again for the opportunity to keep progressing on this important measure, and really thank you to the stakeholders across the design, development, and energy efficiency sectors that have really kept us focused on what we're trying to accomplish. The details matter, and we feel greatly appreciative of Councilmember Wire for convening a meeting recently on the 11th of May to really hash out some of the specifics. There seems to be continued consensus, and even with some of the testimony and some of the specific comments, there's been interim concurrence across the administration and some of the stakeholder comments, particularly around things like construction documentation, really streamlining that process, but ensuring that both the applications that are coming in meet the intention of the bills, and then also that plans reviewers know what to expect so that we can continue to improve and streamline that permitting process. So again, we greatly appreciate Councilmember Wire and team for convening us recently, and we're hopeful and looking forward to passing out, though we recognize that there are a few things still on the table for finalization, and there's concurrence on certain of those items moving forward towards the CD2.
Yeah, appreciate that, Director. And just wanted to say mahalo to you and to your entire team. It's a highly technical bill, and so I know all the work that everyone is doing. You folks are working really hard and diligently on it, and so just truly appreciate it, and your willingness to engage throughout this whole process is noted and welcome. So mahalo for that. I wanted to ask, were there any questions for Director? Didn't see any, so I'll go ahead and go over to testimony just because I think we have some folks. Appreciate that, Director. In person, registered testifiers, we have Stephanie Sakamoto. Gone. Okay, I believe she's no longer present. Do we have anyone in chamber that's not registered? Oh, I believe Mr. Wigg, Howard Wigg, did register. Welcome back. Appreciate you being here. Go ahead and identify yourself and proceed when you're ready.
Chair, Vice Chair Kia'aina, Howard Wig, Hawaii State Energy Office, speaking in support. We have carefully crafted some of these amendments to reduce construction costs. The easiest example is we took the requirement for R13 floor insulation in homes and we reduced it to 0. That saves a lot of money. Number 2, we raise the efficiency level for lights, and that enables either reduced wattage per lamp, or you can remove some of the fixtures because you don't need that many fixtures. That reduces costs. Finally, the mainland code requires insulation for walls and roofs, and we replaced that, or gave the option of reflectivity. Reflectivity in our beautiful climate works very, very well, all of which reduces costs. Thank you.
Mahalo. Any questions for the testifier? Seeing none, mahalo, Mr. Wick. Anyone else present in chamber wishing to testify? Seeing none, we'll go to remote testimony. I believe we have registered Will Kane, and then followed by Greg Thielen. Mr. Kane, please proceed whenever you're ready. Mahalo.
Aloha, Chair, Vice Chair Committee. Will Kane on behalf of Hawaii Gas. So we wanted to testify in support of the CD1 MW4 for the Bill 4. And, as amended, it addresses the concerns we had about misalignment with the state statute and the county energy code. So we appreciate very much the work of the committee and the work of the OCCSR to figure this out and come to a good resolution. I'm here if you have any questions. Mahalo.
Mahalo for that. Just a quick question, and just so there's clarity for the members too, is it your understanding that the amendments that were made weren't necessarily substantive in terms of changing? Well, I guess that would be the conversation, but really it was just to update a reflection of what is already state law. Would that be your understanding of?
Correct. Yes, I think just that clarification helped in making sure that everyone understands that going forward.
Okay, appreciate that. Any questions for the testifier? Okay, sensing none, thank you, Mr. King. Mr. Thielen, if you're on, please proceed whenever you're ready.
Chair, testifier is not present.
Okay, thank you, Madam Clerk. Is there anyone online not registered to testify?
Chair, there are none.
Okay, thank you, Madam Clerk. Members, with that, just double checking, doesn't seem like there's anyone in the chamber wanting to testify. Before I make my recommendation, was there any discussion? We do have CCSR here. Were there any questions? If not, I'd proceed to make my recommendation, noting that this is an ongoing conversation. I know that there's testimony received that's, I think, indicative of some coming together and ability to both prioritize moving us forward in a sustainable way while being mindful of the fine details in terms of impact on cost and design. I'll shoot it over to Councilmember Dos Santos Tam.
Yeah, thank you, Chair. I just have a question for maybe it's OCCSR, maybe it's DPP. In some of the testimony, they brought up that for tract homes, out in Kapolei, Ho'opili, et cetera, where the homes are basically exactly the same, that there's language on sampling that was deleted, as well as some of the information on construction documents having to be on every single one, even though the homes are fundamentally the same. Is this something that can be addressed?
I'll start with the construction documentation, as that's an easy one, and actually there's been interim updates since that and concurrence both from the industry side as well as with DPP in streamlining the expectations on what's required for documentation. So I think there's a clear path and concurrence on that moving forward. And as we've discussed multiple times in past meetings, sampling was never deleted. Sampling persists in the state energy code and is part of the base code which we are working from. And it just appears that it was removed because we're not proactively writing it in as an amendment. There was a concern around some of the enumeration, and there was an amendment to 401.0 401.3 to now 401.4, and all of that follows through with that. So again, sampling was never removed.
Great, I appreciate the clarification. I know it's very difficult when there's multiple codes. We have to and look at how they intersect. So thank you for that.
Vice Chair Kiaina.
Thank you. Thank you, Director. With regard to the concerns raised by the Building Industry Association that the codes being proposed are more stringent than the national or state building codes, especially as it relates to addressing housing affordability. What is your response to that?
It would be best if there was a specific reference. Again, there are many things within the code that have reduced construction costs. There are many things that relate to exemptions from the base code. So sometimes we're tinkering on what can be done outside of what is mandatory and required. So there's potential confusion on if you're changing an exemption and a special treatment that might affect affordability. There's different pathways, so it's difficult to answer it in aggregate, but we've had good relationships and conversations today.
Okay, taking away the housing affordability part, just in general, just more educate me, do we normally make more stringent local codes above state and national standards or codes?
The city always makes local amendments. A lot of it has to do with just how we need to word things. There are always opportunities to improve upon what's important for our local condition. Again, we're actually now talking about a 2018 model code in the year 2023. Across the nation is the 2021 Energy Conservation Code, and they're nearly wrapping up the 2024. So I wouldn't say we're above and beyond what really are model-based codes, and the opportunities that we had to work with stakeholders on the refinements really balance energy efficiency, a whole package of affordability for someone once they're in a structure, and don't, in our view, negatively impact development and affordable housing.
And uniquely tailored for the needs of the county.
Correct. The three intents that we've been working with stakeholders for more than a year on, once we embarked upon updating the state's Energy Conservation Code, were really moving the market into specific efforts around a completely voluntary stretch code and looking at large homes. The second category was maintaining our existing city code around EV and PV ready for both commercial and residential buildings. And to your question there, the third category of amendments was about making it fit for our local conditions.
Thank you so much.
I appreciate that, Vice Chair. And I'll just note, there's some items in the testimony that I think are more technical that need to be adjusted, and then there, maybe additional conversations between stakeholders. And so just want to remind the committee as well that this is to get it out of committee for second reading, and then it'll be back at committee. And so I also think that it may be good for the community to have an updated, clean, or the version that we're passing out today as the baseline for coming back to committee at the next meeting and knowing like, okay, that's the frame of reference, and we can go from there in terms of the conversation. So that is my intention to bring it up today to move out. So I just wanted to offer and invite any additional questions or discussion. Okay, perfect. And then we finished testimony. Okay, so I'm gonna recommend that Bill 4, 2023 be amended to the posted CD1 OCS 2023-0443-5-18-2023 2:52 p.m. Any discussion, any objections, any reservations? Seeing none, Bill 4 is amended. And then the chair then recommends that Bill 4, 2023 CD1 be reported out on second reading and scheduling of a public hearing. Any discussion, objections, or reservations? Hearing none, so ordered. Okay, so I think we're doing okay on time. So we'll move on to agenda item number 5. This is the first of 2 informational briefings. This particular item is an update by Victor Moreland on Sand Island Wastewater Treatment Plant, Secondary Treatment Study. For your information, the presentation is available online at Miscellaneous Communication 262. We'll just make sure that the presentation is up and available. Invite anyone that wanted to come up for the presentation to the front podium over here. And just noting that this is one of 2 items up for discussion. We'll also be having Environmental Services do a separate update and presentation after as well. Chair Waters, did you have a question? Yeah.
After you're done, may I just say a few words before we start?
Yeah, I'll go ahead and throw it over to you.
Okay, well, thank you so much for having this on your agenda today. This was at my request. I did meet with a group of retired engineers who came up with this idea. And the reason why I think it's important for us to have this conversation from both sides, what Victor Moreland and his group are talking about, as well as the Department of Environmental Services, because the City Council and the administration are going to have to make very, very difficult decisions in figuring out how we're going to pay for the upgrade to the Sand Island wastewater treatment plant. And unfortunately, I got to leave at 4 o'clock. I'm having surgery on my hand to remove a skin cancer, and I'm not sure how deep they're going to have to dig it out. But anyway, so I got to leave at 4 o'clock, but I really did want to have both sides answer these questions. Like, what are our alternatives, how realistic these alternatives are in light of what the EPA is mandating, and then how much is this going to cost, and how are we going to pay for it? Because I have mentioned many times during various hearings that, you know, my water bill is $26, but the ENV bill is $100, right? And is that $100 and all of us collectively gonna be enough to pay what might be a $2 billion bill for upgrade to the wastewater treatment plant? And that's something that we as a council have to figure out how we're gonna pay for this without raising taxes. Because I don't think any of us on this panel wanna do that. We don't wanna raise fees, we don't wanna raise taxes, but if we do that, how are we gonna pay for it? And I'm not going to be here for that particular part of the discussion, but I'm hoping members talk about that at the appropriate time. So thank you very much for allowing me to speak at this time.
I appreciate that, Chair. Would you prefer that we have the presentation begin, or did you want to have questions now? Sure? Okay.
Chair, before you begin, can you can I just can you provide some context, because there's only his name on the agenda. So can you contextualize for me, under what authority is he coming here? Is it an organization?
Yeah, so maybe I'll turn it over to him and to outline essentially their background and their experience on this. And I say them meaning there's, I think, a group of public servants that have spent a lot of time researching this particular issue.
Okay, but you're speaking, I see the presentation, Malama Honua, that is an organization, correct?
No.
Yeah, I'll go ahead and turn it over to the speaker, let you address the questions to him, and then can go ahead.
Aloha, folks. My name is Victor Moreland. Thank you, folks, for introducing me. The group is actually a bunch of folks that have been in this business from anything from 45 to 50 plus years. Myself, I'm right at the 50 mark. So we've been involved in all of this for that long. There's a total of 7 of us, and there's actually a couple of folks who are sitting over here in the background over here to answer any questions that I might not be able to. But that group has been involved in the whole concept of doing primary treatment with a deep ocean outfall since the early 70s. And if we get in here, and you'll notice on the title, we're looking at higher sewer fees, which was mentioned by your chair, unnecessary treatment, and produces substantial greenhouse gases. And the question is, does Sand Island Wastewater Treatment Plant secondary treatment benefit our environment? And the Malama Honua is just to care for your land. So the presentation is kind of an overview. I'm not going to read all the way through all of these slides. You folks, I know, can read, so please read at your leisure as we go through. But the bottom line is we have several different places that we want to try to get folks to think about things. And in there, a little bit of the question that was asking who we are. Oops, sorry. We're recognized, we're kupuna in a lot of folks' mind. We're the senior folks. Pretty much everybody is like 70 and above. I'm not going to tell you where I'm at. And we really feel like we have to be a voice, and that's our kuleana, because of what we've been doing for all of these years. And the reason for part of that is that the city has been silent on this whole issue. Now, there's some more things for you to read there, and we've been involved in Hawaii water pollution from, like I said, the 70s. A good number of all of our group have, at one time or another, worked at the University of Hawaii at Manoa, and involved in research, teaching, and so forth. And a couple of the folks actually were the authors of the water quality standards for the Department of Health back in the 70s. So this is kind of where we're at with all of the different parts, and please read. I'm not going to go through too much of it, but really our concern is Malama, the island. Take care of what we're doing here. And to address the pollution challenges and think about where do you want to spend your money to improve the whole environment, not just one treatment plant at this point. Oh, sorry. So these are some of the significant water quality legislations that have been passed, and these are all federal. It's interesting to note, for some of you who don't know this, the first real act that affected water pollution was in 1948. The significant one that most everybody remembers is what happened in 1972 with what's referred to as the Clean Water Act. And you can see there was some others, the Water Quality Act of 1965, which to us tried to do the right thing, and that was let the states determine their own water quality requirements and implement what is needed for treatment for all of those discharges. Remember now, we're talking about the mainland now. They have inland water discharges. We have, with the exception of Wahiawa on this island, which discharges into the Wahiawa Reservoir, although a lot of folks like to call it Lake Wilson, but it was constructed as a reservoir for the plantation, okay? So the problem was the federal government never funded anything. So of course the states don't have that kind of discretionary money. They couldn't go forward. So next thing you know, EPA comes out with a one-size-fits-all concept with the Clean Water Act. And that challenge has been going on ever since. And there's been a number of, another real significant is finally in the early 80s, they came out with the construction grants program, which really helped. And the city and county, neighbor islands also got money for that. This is not so easy to see here, but this is what, if you look at the red dots, those are the city and county facilities that were there from the 70s. Very few of them are left now. There was a total of 17, and we've got, if I remember correctly, so roughly in the neighborhood of about 9 that are owned by city and county. And you'll notice that there are, sorry I don't have a pointer, but you can look around the edge of the island and you'll see some references to outfalls. These were all shallow. So there was in 1974, let me back up just a minute. In 1971, there was the Water Quality Program for Oahu, which stated in there, get the wastewater out of all of the inland waters. It virtually prompted the whole concept of what is a lot of us call the Muskie hearing. And the title of that actual hearing is up there in the blue line. Now in there was oral and written testimony provided, and you can read for yourself there the categories. The important thing out of it is that Congress actually ended up modifying the Clean Water Act, adding the 301H waiver program as a result of that hearing. And part of it is, as you can read there, we are unique. I mean, if you stop and really think about Hawaii, we have no continental shelves. Why? Well, we're basically a mountain range piercing the open ocean. And a lot of folks have forgotten that. And not enough folks on the federal government side stop and think about it as to the difference in the impacts and how that relationship between the ocean and our islands are. So that's a real point to all of what we're talking about here. This is just a lineup of all of the folks that gave oral testimony. And you'll notice in there that there was nobody that was not positive. You had a couple of no positions, and Gavin Dawes recommended an EIS. And you'll notice that there were 3 environmental organizations that gave testimony. So now we look at the significant water quality events for our state and the impacts basically for our island, city and county of Honolulu. And you'll notice that's the water quality program that I mentioned earlier. That was really the development of it all. Then we had the Muskie hearing. And then as we moved down through it all, the Water Resources Research Center started actually monitoring outfalls as far back as 1985 and continued with a contract from the city to monitor those same outfalls from 1990, and they did it all the way up to the last I knew, at least last year. And what of real note there is the National Research Council in 1993 actually made a point. Advanced primary treatment is an effective treatment for controlling total suspended solids. That's the TSS. The BOD, or biochemical oxygen demand, which the subscript 5 is for a 5-day test. And that they're saying is a minor concern when discharged into a deep ocean environment with a well-designed outfall. And that's important to remember. One of the offshoots of the wonderfulness of EPA and their inaction on actually giving a waiver to the city and county for Sand Island was that they got sued. And the result of that was the Mamala Bay Water Quality Study, which is a 3-year project. The only major recommendation was to add disinfection. And quite honestly, it's not really that needed because of the conditions that we've got. One of the recommendations, which we'll be getting to later, is talking about going actually deeper. This is just to give you a rough idea of a layout of a possible wastewater treatment facility that actually, in this case, I think goes to actually almost advanced treatment. And this is just a guidance tool. This is a great overall aerial for the Sand Island, which not too many people have seen that right from that view. This is now the Sand Island Disposal and 301H waiver history. And in there, the parts that I'm going to concentrate on is in the 1950s, the discharge was raw wastewater, about 7/10 of a mile offshore in 38 feet depth.
Apologies to interrupt. I'm just going to hand the gavel over to Vice Chair Kiaina briefly. Please continue.
And I don't know if any of you ever flew over that when you came back Neighbor Island and saw this. We've got a picture to show you what it looked like. In there now, there was, in 1978, the discharge became screened wastewater through the new outfall at that time. That took it out about 1.5 miles into a depth of 240 feet, which gets it down to the depth where we're talking about a nutrient desert relative to the environment of the ocean. The rest of it is that the primary treatment came online in 1987. The city and county actually applied for the 301H waiver back in 1980. And you can see kind of in that history right there, EPA was not too quick on making decisions. They had tentative decision, then really no action. And as a consequence, Sierra Club, Hawaii 1,000 Friends sued the city, basically generating that Mamala Bay study that I had mentioned earlier. And that was because they got caught, the city and county got caught without having a waiver permit and not discharging secondary effluent. So whose fault was it? Between you and me, EPA. And then finally got a tentative, actually got a permit in 1995. This is just a drawing showing the old outfall in red and the current outfall in blue. And we'll be using it as a reference for when we talk about the extension of the outfall. This, oops, sorry. This is the upper two photos are what it looked like with the old outfall, that plume. I can still remember, for those of you who didn't see it when you came back or went to neighbor islands, I can remember actually seeing boats with folks out there fishing in that plume. And that's what the bottom looked like, worms and all kinds of debris. The bottom is what, in that same concept of being very close to the outfall right there, and what it looks like today, and at the time these photos were taken. Nice pristine water up above, and you got starfish and all kinds of life going on around the outfall itself. So do you need to improve the water any more than that? That's a real question. This is getting more specific into that disposal and the 301H. But back in 2007, Mayor Hanneman actually got a group of folks, which he called his EPA, which was Environmental Panel of Advisors. Those folks included one of the folks in the back there, actually two of the folks, James Honke, Jimmy Kumagai, Hans Kroc, and myself were advisors to Mayor Hanneman. We recommended fighting EPA all the way because we felt that you could win in the long run if you get them to pay attention to the science and not the political nature of trying to get rid of a 301H waiver program. And as you can see in that history, ultimately they did a tentative denial and then they did the full denial. And at that point, my understanding and the general understanding of our group was even the Corp Council agreed with what we were saying and were surprised when Mayor Hanneman actually signed the consent decree. That came a shock to them as well. We met with members of Mayor Blangiardi's team. We gave him all of the facts and information relative to it, told him that it's unneeded. He actually had a couple of his directors there, and my understanding, I did not attend that meeting, but I understand that those folks who were there as part of Blangiardi's team said that the group was correct. It's not really necessary to go to secondary. Now you're looking at, after meeting with them and getting no response from the mayor or anybody out of that staff, next thing we know is they've awarded the contract and then also given a notice to proceed with nothing being mentioned to our group. And as the last part there, even today, we still remain committed to the fact that secondary treatment is really unnecessary. And you're not going to get or see any benefit in our ocean waters because of doing it. It's kind of like doing a water reuse and then putting it down a pipe and sending it out to the ocean. Nobody benefits, and the environment is now going to have a problem with all of the CO2 that's going to be generated for the power, as well as the biological process, which the end products are water and carbon dioxide. Now, one of the things when you look at the carbon footprint of one of these facilities, they say that the biological generation of CO2 is part of a natural carbon cycle. Therefore, they don't assign it to that facility as part of their carbon footprint. But the bottom line is it still goes into the atmosphere. So you still got all of that that's going in there.
I think maybe we could pause here and take questions.
Sure.
I know we may lose some members at 4. I just wanted to see, were there any questions up until this point? Otherwise, I'll have the presentation. Chair Waters.
Yeah, thank you so much. I mean, you speak with a lot of authority. What was your job? And if you could introduce the two gentlemen sitting next to you, just, I mean, so that just your qualifications to be testifying on this type of important matter.
Sorry. First got out of UH with my master's. I went to work for actually the state of Hawaii Department of Health. I was a state assignee actually hired by EPA. Then I left them and went to work for the Navy Civil Service for the environmental group at what was called PACDIV at the time. After that, I went to work for a private sector and continued doing that. And back in 1972, a good friend of mine who was at the university mentioned that the School of Engineering was going to have a PhD program for environmental engineering. So I applied and was accepted, and I was actually the first enrolled student in the program. However, a guy transferred in from Arizona and got out of school before I did. But I'm the first one to complete the program all the way through. After that, I went to work for the Water Resources Research Center and worked there for 14 years until I retired from there in 2012. And I was only working for them half-time, so I was still doing consulting, which meant I was working with other engineering firms as an advisor and so on. The other thing which kind of is a little different than most of the folks who have some of the degrees like I do is I'm also a certified wastewater treatment plant operator grade 4 for the state of Hawaii, which I actually got back in 1989. So I have done plant optimizations, I've turned valves, I know what it's like to be out in the field. And then after that, I went into semi-retirement. I'm still working for other firms. I've done work for contractors and startup of facilities and so forth. Any questions in regard to all of that?
No, real quick, who are the two gentlemen that you brought as well?
Me. Oh, there they are. They came closer. Oh, spooky. Oh, man, that was like a transformation coming from the back.
Yeah, I brought them from the back.
In the green, we have James Honke, who worked at the same place I worked at, not at the same time, and he worked for the city for, I think, 25 to almost 30 years. And retired. He's one of the retirees. Great reference for a lot of different things. He was totally involved in all of the waivers from the very beginning for the city. And then in the red is James Kumagai, who I worked for at Emily Pacific, so did James Honke. And so I've known him since the, late 70s, my God. Poor thing, I feel sorry for him. He had to work with me. And I think most of you folks probably have heard that name in one way or another. He's a really great guy, easy to talk to, very knowledgeable, been involved in water quality issues from the very beginning of what's going on in the state, was involved in the water quality program for Oahu, involved with the water quality standards for the state and so forth. And he's fully retired at this point. He said he's had enough of the challenges.
Thank you. What is your motive here today? Being that you folks are retired, you have no financial motive here, right?
Well, the bottom line is I don't want to have to pay any more than I have to for my sewer fees. But the bottom line is it's actually far bigger than that, and that is we need to be partners with nature. And currently, as they're going down the path, to me, that's just not being a partner with nature. We can actually, by discharging and taking it to a deeper outfall and putting it even further down into the nutrient desert, it's actually going to be a benefit. And we've got some information showing later that when you look at the suspended solid side of everything, it's pretty comparable to what you get as far as the requirements for secondary treatment, which is 30 milligrams per liter of BOD5 and 30 milligrams per liter of TSS. It's going to be close for the TSS. The BOD side, what the advanced treatment, as we're calling it, well, some folks like to call it, but the primary filtration is not going to get rid of that dissolved food, but it'll take care of a lot of all of the bound up in the solids, or what is referred to as particulate BOD. So we're looking at it, and I look at it from the standpoint of being a better partner and doing better stewardship with our environment. And at the same time, saving everybody a lot of money and not putting more pollution into the atmosphere.
So just as a last follow-up question, Chair, you spent a lot of time talking about the Clean Water Act and what's required. Mm-hmm. And we currently do not have a waiver, a Correct. 301H waiver, which would allow us to do what you're suggesting.
Well,
I've almost done. I've heard, you know, and I'm sure we're going to hear from the ENV department, that ship is sailed. You need either an act of Congress or something very drastic to be able to get that 301H permit in light of the fact that the city is already, and it's no fault to this current administration, they're following the consent decree that was signed back from the Hanneman administration.
Right.
So being realistic, how do you undo any of that?
Well, if you look to the city of San Diego and what they did, they never really had a permit, and they got caught in that 1988 window being closed for getting a waiver. So they were on a consent decree. The mayor at that time said, okay, I'm not going to fight it. Let's just go with secondary. Then he got the sticker shock when he found out how much it was going to cost, and he said, okay, we've got to do something other than that. So they went to court with the USA, and that's Department of Justice and EPA. Now, the interesting thing, which is not on this, but this is pretty small writing, but this is the letter from the city attorney to the mayor, basically describing what took place. And this is the bottom line context of that letter. And Judge Brewster rejected the consent decree as not in the interest of the public, and basically for no environmental benefit, which we have the same circumstance, no environmental benefit. It's a wasteful overtreatment. Well, the same thing could be said right here for the Sand Island. It requires unnecessary sludge production, and that's absolutely true if we go to secondary, because that's going to generate more sludge than you've got with the primary sludge coming out of the facility as is. And in their case, they had a requirement for reclamation of water, which the way it had been written in the consent decree, they were to treat like whatever number of MGD, whatever was not being used, they would send it down to the Point Loma facility, which is where they do the primary treatment and discharge through an outfall. Well, now you've treated all this water with its purpose and destination, an outfall going into the ocean. So the judge said, unnecessary reclamation facilities. Why are you doing it and then tossing it into the ocean? It's not being used anywhere as a supplement or as a replacement for other water sources.
Thank you. Thank you, Chair.
So,
yeah, Mahalo. I'll go over to Vice Chair Aina.
I have no questions. I actually, for time purposes, just because it's, I'm also going to have to be leaving at 4:45. So I just was wondering, perhaps, can we hear from the Department of Environmental Services, and if we have any questions, we could address it to the appropriate parties.
Yeah.
I'm worried that I'm not going to be able to hear from them before I leave.
No,
there's
appreciate
not
that.
much more to go.
So yeah, we were just wrapping up with this one. Seems like no questions from other council members. I know we'd mentioned, I think Ryan mentioned 15 minutes. Can we spend maybe a few minutes just wrapping up if there's any high points?
One of the things
go ahead.
is there's already a waiver that's been given also to American Samoa for primary treatment and disinfection. And you know, the bottom line out of this whole thing is we're saying that the city should really be looking at beneficial environmental impact and financial investment. So now if we kind of skip past this part and we get past the alternatives that we were looking at, I think these are a list of, and it's not a comprehensive everything that's potential for what could be done there, but this is a pretty decent list of things that the city could be spending to help the whole total environment rather than just this one wastewater facility. And these are kind of the steps that can be done. And yes, somebody brought up, there was legislation that was generated by the city of San Diego through their California representative to get what is called OPRA, or Ocean Pollution Reduction Act. And it was specifically for the city of San Diego. The same thing could potentially be done or added to as an amendment to the existing OPRA for the city and county of Honolulu. And if you stop and think about what the circumstances are for San Diego, we have even a better reason from the standpoint of our oceanographic conditions, which is getting to deep water much sooner than they can. They're out at 3.5 miles. It's still only 300 feet. We can take it to 600 feet by only adding another 3/4 of a mile at the most to the existing outfall. And then you've got the whole outreach issue. But the one thing that this is the one I was referring to when you're looking at what are the differences. Right now, the upper line is what exists, the current. The next line is once the first increment of the membrane bioreactor is completed, you're looking at a split of flow of roughly 20 for the MBR and 40 for the primary effluent. And you can see the numbers there as far as percent removal and what kind of numbers you're going to get for BOD and suspended solids. Well, it's not until you get the whole MBR, but again, remember that water is not going anywhere for any subsequent use. The other thing to also remember with it is there's enough chlorides in that water as it is, even with the reduction that they've done in the flow and getting less of the brackish water into the collection system, that it still works as a herbicide. So it's not going to be of any benefit for plants unless they're really salt tolerant. And what we're looking at for primary filtration, the numbers on the suspended solids, we had 79% based on some studies that were actually done here for Sand Island. I talked to a friend of mine who's involved in doing with some of the primary filtration that they're doing right now on the mainland. And he said that instead of the 79%, you should probably be able to see 82 to possibly 86% reduction in the suspended solids. So instead of that number being 41 for the effluent quality, you're looking at it being around 35 and under 30, depending on which of those and how well that'll get into the 80s. So that is pretty much equivalent or potentially very close to what you're getting with secondary treatment as far as what is required by the NPDES permits. The only problem is, again, that dissolved BOD potentially getting there. But I think one of the things that is important, and this is something that we as a group look at, and that is things to think about. And there's an individual, Barry Commoner, who is a biologist, and a lot of folks consider him a truly good and excellent ecologist. He had laws of ecology, and the first one is everything is connected to everything else. Everything must go somewhere. Nature knows best, and there is no such thing as a free lunch. You're going to have to pay for it one place or another. It's just a matter of how much do you want to delay before you pay. And then this other one is something that somebody showed me probably on the order of about 40 years ago, this environmental thought. And interestingly enough, it actually came from the industry, a 3M company individual. And what the individual came up with based on his interaction with everything, and this is something that was generated back in the 70s and 80s. Environmental issues are emotional. Environmental decisions are political. Environmental solutions are technical. And where Sand Island has been is in number 2 in the political decision area while not looking at the real solutions. So with that, any other questions? And just a reminder of the difference between the outfalls of the old and the new or current.
Mahalo, appreciate that. Appreciate you making time also to meet offline with our staff. So I'm sure, I don't want to offer you up for everyone, but I'm assuming you'd be willing to meet with other offices if they're interested.
Yeah, I mean, I can stick around if you folks have questions after.
Not necessarily today, but feel free to stand by.
Okay.
Per Vice Chair's request, we'll move on to the next presentation. Were there any other questions? Okay, mahalo again for this.
No, thank you folks for giving us this opportunity.
Yeah.
Mahalo.
Appreciate your service. Mahalo. And then we'll go ahead and bring up environmental services. I'll note as you're walking up, don't believe we have any in-person or remote folks signed up to testify. Is that correct?
Correct, Chair.
Okay, I believe there may be one person, or is there anyone in the chamber wishing to testify? Sensing none. and no one online. We'll go into discussion. Sensing no discussion, we'll close testimony on that item and move on to number 6, update by the Department of Environmental Services on Sand Island wastewater treatment plant secondary treatment study. The presentations are available online is Department of Communications 345 and 346. I'll go ahead and turn it over to you, Director Babcock. Mahalo for being here.
Yeah, good afternoon, Chair Wire, Vice Chair Kiaina, and other committee members. Roger Babcock, Director of Department of Environmental Services. As we bring up the, we actually submitted 2 presentations. One is an update on the status of the secondary treatment upgrade at Sand Island. And I think we're going to skip that because we're a little bit over on time, but I'll just give you some really quick updates without showing it to you. You have it there. Just so you know, the Sand Island secondary wastewater treatment plant upgrade has begun. Contract was awarded. And phase 1, there are 2 phases. Phase 1 began construction. NTP was issued in December of 2021. It's currently 23% complete. Phase 1 will be completed by contract by December of 2026. Phase 2 is currently in design, and it needs to, we need to issue a notice to proceed for construction by 2030, which sounds like a ways away, but it's actually going to come up pretty quickly, and construction has to be completed by December 31st of 2035. So we'll go ahead and look at these slides then, which is really about the consent decree. So I'll go ahead with the next one, Mike. As you know, Deputy Director Mike O'Keefe is here turning the slides. So the 2010 consent decree, as shown, was signed in 2010. And so I'm going to give a little bit of background about that and then try and address some of the comments from earlier. Just so you know, the consent decree was signed in 2010. It's the city, between the city, the United States EPA, the State Department of Health, and 3 NGOs entered into the consent decree. There are several sections that are important that talk about what we have to do. Section 6 is the collection system requirements. That includes force mains, the gravity sewers, and that had 10 years worth of projects and needed to be completed in 2020. Section 7 covers the wastewater treatment plant upgrades, and one of them is for Honolulu, which is given until 2024, 14 years. And the second one is the Sand Island wastewater treatment plant, which was given 25 years to be completed. In June 30th of 2020 was the collection system requirements completion date. And all the projects were completed with the exception of a single project which received an extension and was completed on time within the extension. And so we'll go ahead and go to the next slide. This is what the consent decree looks like. The consent decree is a 155-page document. It's available on the ENV website, and you can easily find it if you go to the website and click on consent decree. It's there with a bunch of other documents. As part of the consent decree, there was penalties paid by the city, $800,000 to EPA and $800,000 to the Department of Health in 2010. It was a request to find out what other penalties there would be. So the stipulated penalties that are included would be assessed if there are any missed deadlines. So far, there have been no missed deadlines. It's $15,000 for the first month. They're actually daily fines of $500 a day. It bumps up in the second month if you're missing a deadline to $1,000 a day, and then $2,000 a day after 3 months. And so the amounts that it would cost per year are shown there. Okay, so next slide. So the consent decree, the signatories of that are Judge Ezra from the United States District Judge, and the other folks that are listed there. There's EPA folks, there's Department of Health folks, and then there's two legal teams representing the non-governmental organizations. On the city side, the mayor and several other directors were required to sign the consent decree. Going forward, or kind of going back, as Mr. Moreland, Vic mentioned, there's a lot of history. Started even before this, but in 1972 Clean Water Act, also known as Public Law 95-217, or the Federal Water Pollution Control Act. It had the goals that are shown there to make all the waters fishable and swimmable. Their goal was mid-1983, to eliminate all discharges of any pollutants by 1985. That was the goals in 1972. But basically, it established a basic structure to regulate discharges of pollutants into the waters of the United States. As part of that, they issued something called National Pollutant Discharge Elimination System permits. And most states, including Hawaii, they delegated this authority to the State Department of Health. And these permits are issued and must be renewed every 5 years. The basically, Clean Water Act says that all treatment plants must treat to secondary standards, which is 30 milligrams per liter of BOD in suspended solids on a 30-day average, with overall 85% removal, and pH between 6 and 9. A lot of other things are added after that. As part of the Clean Water Act, they did provide, as was mentioned, the 301H waivers for secondary treatment. These waivers are secondary, are discretionary, sorry, and they also, once they are no longer granted, they cannot be reinstated if once a waiver is taken away or given up. And right now, only San Diego still has a waiver, and that was via amendments to the Clean Water Act, a specific amendment for them. Next slide. So a little bit more about the timeline. So in 1979, Honolulu did apply for a waiver for Honolulu and Sand Island treatment plants. In 88, the Clean Water Act, as was mentioned, closed applications for such waivers. In 1990, EPA did issue waivers for Honolulu and Sand Island that expire in 1995, the standard 5-year period. So between 95 and 2005, there were renewal applications were submitted, and they were under review. And during that time, the city operated under what's called an administrative extension, which, as Mr. Moreland mentioned. In 1995, there was also separately a different kind of consent decree, which was issued over sanitary sewer overflows for the city. There were other administrative orders issued in 99, 2002, 2003, and 2004 over permit violations and spills. Then in 2004, as was also mentioned earlier, 3 non-governmental organizations filed lawsuit. Finally, in 2005, the EPA informed the mayor that the waivers would not be renewed. In 2006, unfortunately, there was a beach walk force main break, diverting 45 million gallons of raw sewage into the Alawai Canal. And in 2006, negotiations began, and they continued through 2009. 2007, the EPA issued their tentative denial. 2009, they issued their final denial, and the city appealed. In 2010, the mayor meets with the EPA and negotiates the consent decree. At that time, it was the longest consent decree ever issued. The consent decree settles the old consent decree, all the administrative orders, and the lawsuits. Then there are 3 organizations that are party to the agreement: Sierra Club, Hawaii 1,000 Friends, and our Children's Earth Foundation. Okay, so overall, what the consent decree does, it replaced the 95 consent decree, the 2007 stipulated order, and the 2 sets of complaints by the non-government organization, terminates all outstanding litigation, and it also withdraws, as a condition, withdraws the city appeal for secondary waivers. So the waivers are gone, as was mentioned. It allows the city to not comply with secondary treatment regulations until the upgrades are completed in 2024 and 2035. Overall, what it says in there, it was designed, this is in the consent decree, to avoid further litigation, that it was a good faith negotiation, and the judge's quote was, "It's fair, reasonable, and in the public interest." Okay, so overview of the projects. I think maybe we're just going to go through this really quick. The collection system projects, there are 146 projects in the consent decree. About $1.4 billion was spent on those projects, and they're all completed. The impact, those are all geared towards sanitary sewer overflows or spills, making less of them. It was successful. At the time of the consent decree, it was about 136 reportable spills per year. And by 2021, it was down to, when that work was done, it was down to about 60. A little bit about costs. It does cost money. This Honolulu secondary treatment plant upgrade is about approximately $500 million. And that's almost completed. And the estimated cost for Sand Island upgrade is $2.87 billion, as shown there. Okay, we'll go to the next one, Mike. So the collection system projects, I think we'll just skip this. There's a lot of projects that needed to be completed by certain deadlines, and they were. You can look at that yourself. Second one is about gravity sewer systems. So the first ones are about force mains. This page is about the gravity sewer projects, and those were all completed. Here's more about collection system projects. They include prevention programs, O&M manuals, staffing, standard training, it's very comprehensive. This is all in the consent decree, and those things were all accomplished. Okay, Mike, we'll move on to finally to secondary treatment at Sand Island. As mentioned, we have for Honolulu, sorry, this is Honolulu. Honolulu, I think we'll skip that. Let's go to Sand Island. Okay, so for Sand Island, the requirements are that we have to issue a design contract by January 1st of 2019. So that was accomplished. It was by just a day, December 31st of 2018. Phase one, it was decided to go with a membrane bioreactor system to treat 20 million gallons a day of the flow. The average daily flow is 60 MGD, so it's about 1/3 of the average daily flow. Construction NTP was issued. Construction is underway. And as I mentioned, it is about 23% complete today. We need to issue, as I mentioned, the NTP for the entire upgrade by January 1st of 2030. The planning project for that was issued in 2022. And we need to complete the design for 70 additional million gallons per day of treatment and award a construction contract. We're planning to do that in 2029. Okay, next slide. Okay, so I think the basic question is, is secondary treatment really needed? And to acknowledge, a lot that's been said is Sand Island Wastewater Treatment Plant currently provides better than primary treatment. It's called a primary treatment plant. But it does use enhanced primary treatment as well as disinfection. So there's some dates there of when things were installed. And it is correct that extensive monitoring of the receiving waters over several decades has indicated no adverse effects of the Sand Island Wastewater Treatment Plant discharge. However, the 1972 Clean Water Act does require secondary treatment. And as mentioned, it did provide for waivers, but those do have to be renewed, just like any other permit. And so the federal government and the state and Department of Health can decide at any time that they're not going to renew a waiver. And overall, the idea that treatment, a certain level of treatment is not needed to protect environment or public health has really never been successful in wastewater or drinking water or other things that we take care of, including air emissions and landfills. And so this is a really big challenge to make that argument that it's not needed, and that therefore that you don't have to do it. So can we do what San Diego did? And In order to do that, the Clean Water Act would have to be amended via federal legislation to carve out a special case for Honolulu, like what was done in San Diego. And that would presumably require majority support in the House and Senate and signature by the president. And the timeline of doing something like that is unknown. The consent decree, of course, would have to be modified via the federal court judge, and the litigants would have to agree, and currently they do not agree. Litigants meaning the EPA, the Department of Health, and the 3 non-governmental organizations. The San Diego was able to get their waiver and keep it via a Clean Water Act amendment by the Congress, and they justified it, as was mentioned, that they needed to be able to recycle their wastewater for drinking, essentially, and thus reduce discharges. And by doing that, they reduced the discharges to the ocean to the same degree as if they had implemented secondary treatment before the outfall. So they did it by treating the water and not putting it out into the ocean, and then the remainder that is treated only in terms of the amount of mass of pollutants that will go out into the ocean, it's equivalent to doing secondary treatment for the whole thing, and we're not able to do that. So next slide. So there was an issue raised about whether this was worked out with the public and with council. Just to point out that the consent decree resulted from federal court proceedings with litigants and defendant. The city is the defendant. The litigants were the U.S. Department of Justice, State Department of Health, and the city is the defendant. And that just kind of goes through how the city defends itself. The court proceedings like that don't involve public participation, and whether or not you win or lose or what the public thinks is not part of the process. But there is a public participation process as part of the consent decree. It's mentioned in section 21. So the consent decree was lodged with the court for a 30-day comment period. It was published in the newspapers and things like that. And the court did reserve the right to, based on any feedback received, that they could rescind the consent decree at that time during that, after that 30-day period, but they did not do that. One last slide I have is what would have to happen if we were to try to modify the consent decree. There are 3 potential areas where that sort of address ending the consent decree. One would be termination. Termination really means you've finished everything in the consent decree, so it's not really appropriate. There's a section that's about disputes. If you had a dispute, but that really isn't a way to modify the terms of the consent decree. So, but there is a section called modifications, and that can occur by written agreement between the federal government, the state, and the city and county of Honolulu, and it has to be approved by the court. And it describes material versus non-material modifications, and eliminating the need for secondary treatment at Sand Island would be a material modification. And the U.S., the state, and the city would have to file a joint motion with the court to modify the consent decree and provide that to all the parties, which includes the non-governmental organizations, and those are called the interveners. And they can oppose the motion, it's likely that they would, and they have time to do that, 60 days. And then, but the judge does have the ability to approve a modification, even if it's opposed by the interveners, but only if he can determine that, if he's convinced that the U.S. position is arbitrary and capricious. And of course, these things can be appealed potentially to a higher court. If we were to try to do this process, during that process, all requirements and stipulated penalties remain in place. So they would continue to accumulate if we were to be in court and trying to do these other things. So we really need to continue, constructing in order to meet the deadlines, because then we would pay the fines and still have to do the work. Modification, though, of the consent decree is would likely not be entertained at all unless there was first a successful amendment to the Clean Water Act that would enable the reinstatement of the waiver. Otherwise, I don't think the judge or anybody else would entertain it. So those are some slides for you, and I'm sorry we took so long, but we'd be happy to answer any questions.
No, that's extremely helpful. So mahalo, Director. I'll turn it over to Vice Chair Kiaina, and then if anyone else
Thank you. Just
has
a couple of quick questions. But first of all, I'd like to thank both presenters for your presentations. Clearly, it's a complex issue, but of course an important issue because it's impacting all of us, right? And so I guess let me talk about process first with regard to a potential waiver. I want to make clear I understand that. So it wouldn't just be getting federal legislation, it'd also be you'd have to get the federal court to also, so it would be a two-step process, correct? Okay, so with regard to, I'm just trying to educate myself. So with regard to the time that San Diego got it, the legislation, was that part of, you said a CWA amendment, was that part of a reauthorization or was it a freestanding amendment to the act that got passed?
Yeah, I'm sorry, I don't know the answer to that, Council Member.
Well, the reason for me, of course, is because, you know, it makes a difference, right? If it was, either way, it doesn't look good for us. If it was within the context of a larger bill and they were the only one who got it, then, you know, surely the Hawaii delegation knew about it and could have fought for it. But the fact that they were the only ones singled out, say if it was an omnibus bill, is telling. Second, if it was done freestanding without, as not part of a larger bill, that also is very, very difficult. And most bills of that nature are, and I'm even curious if it, I doubt that it went for a vote. If it, normally those type of measures would be voice voted. The two senators from California, of course, you know, have a lot of clout. And at this time, Senator Inouye was around, and he also had a lot of clout. So I'm just trying to process in my head what went on. I can tell you today, the likelihood of this happening is nil. The climate is not, it's actually worse than it was. When did this amendment pass for San Diego?
You know, I don't have that date. I'm not really sure when they got their amendment.
Anyway,
Yeah.
I'm just trying to think here. And then my last question, because I know others might have questions. You state here that the San Island wastewater treatment plant provides greater than primary treatment. So just hypothetically, are you telling me that even if we got the waiver, that what you're undertaking now is still adequate for addressing the concerns that have been raised? Or would you wish that we had a waiver?
Well, so, yeah, thank you for that question, Council Member. So currently the Sand Island wastewater treatment plant treats to greater than normal primary level treatment, but less than full secondary treatment. So it's kind of in between. Has about 60% removal of suspended solids, about 30% removal of BOD. The Clean Water Act requirement is 85% of both, so it's quite a bit higher. Whether or not what I would like is I would like us to follow up with our commitments that have been made and complete the project. I think the risks of not doing that are very high, you know, for the city. And it is, you know, it was something that was decided, you know, a number of years ago, and it's considered settled by all the parties.
And if you don't abide, you would face penalties, correct? Fines.
Absolutely, yeah.
Okay, thank you so much.
Councilmember Okimoto.
Thank you, Chair. Thank you, Director Babcock. Really quick, on the page where it has overview of consent decree projects, I wanted to just clarify. I know that you mentioned the cost of the estimated cost for the Sand Island. I was confused as it has 2,870 million estimated, and that is 2.87 billion, correct?
Correct, yes.
And when we compare it to the 500 million, I wanted to understand why there was such a huge discrepancy between the two. And then also, how are we projected to fund this at such a high cost?
Yeah, thanks for the question. So the Honolulu wastewater treatment plant is a lot smaller. It has a average flow of about 25 MGD. It gets peak flows. It can handle maybe about 90 million gallons a day under, extreme conditions. The Sand Island treatment plant is much, much bigger. So average flow is about 60 MGD, but it has the design flow that we'll be working with is 90 million gallons a day, and what we call the maximum month, and that's something you would see pretty much every year. And then it has to be able to handle flows of about 260 million gallons a day, so it's a much larger treatment plant. It's also on a very confined footprint. It's on Sand Island, which is very near sea level. So construction is very expensive there because it's in groundwater. Right below the ground is groundwater. So it's much more expensive project, and it needs to be. It's a very intensive type of construction because of a very small space that's available. So those things contribute together to kind of make the cost very high. In terms of how we're paying for it, we have a long-term CIP plan, which includes this project. And it is correct that we will be needing to increase sewer fees in order to be able to pay for this project, as well as all of our other, in addition to all of our other projects, and improving the collection system, improving other treatment plants, and maintaining the whole system. We currently have a rate study underway. Sewer rates haven't been increased since 2017. So it's been 6 years of having the same sewer rate. And many things have gone up just in terms of operations in those past 6 years. I think, we buy a lot of fuel and a lot of electricity, and I think all of our electricity and fuel bills have gone up since 2017. So, but in addition, construction is expensive. So we will be coming to council sometime fairly soon with a proposed 5-year rate package that will help us fund this project, and but fees will have to increase, and that was known back in 2010. There was a large rate increase that was passed at that time, and ended in 2017. But it was known at the time that wasn't going to be enough. That further increases would be needed.
Thank you, Director. So the rate increase you're talking about, you have a plan. Do you have an idea, and is it staggered or? Because what we would hate to do is, again, and we know that we're trying to help the people in cost of living. I understand if this is necessary, but just to be prepared, what kind of rates are we looking at?
Yeah, the numbers that have been looked at in the past, so this isn't really new, but what we're currently working with is 3 to perhaps 6% per year over the next years until this project is completed.
Every year, it would go up 3 to 6%.
Every year.
Every year. And you said 5 years? Is that when you were doing 5 years?
The current package is for 5 years, so generally you only do 5 years at a time.
Okay. Thank you, Director. Thank you, Chair.
Thank you. Just to clarify, so 2035 is the end of the project?
Correct.
Okay, so understanding there'd be a new 5-year package, you're saying it'd be 3 to 6% for the next 12 years? Or not necessarily?
That's correct.
Okay.
Yeah, but we'll be doing 5 years, and then after the 5 years, somebody else is going to have to come back with another plan to finish it.
Why wasn't it raised for the past 5 years? Was that council action or department decision? Because I know Board of Water Supply, which I think they control their own rates, also had a catch-up period because they didn't raise them for so long.
Yeah, so I can't say for sure because we weren't here. I'm sure that it was the past COVID years were not good times to do rate increases. So the last several years, before that there may have been budget issues and stuff that it wasn't the right time.
Okay, appreciate that, Councilmember Say.
Director Babcock, first and foremost, let me state for the record, I am not an expert on this particular issue. I am ignorant and I want to learn. The alternatives that was presented by Mr. Moreland, is it feasible? This is alternative number one. They wanted the outfall extension to maybe 600 feet depth. I don't know. But this is their idea of trying to address the costs of our system that we have in place. I'll just bring this up because they're saying it's going to be a one-time capital cost of $100 million. And then alternative number two, I don't know anything about primary filtration, even though they also have the outfall extension. So I just wanted to get your thoughts. If we continue on the path that we are today, there will be an increase in the next 5 years, which is a given. With these two alternatives that was presented, I think we could save some money whereby, but before we even address that, you said the secondary treatment plant is, phase one is completed and we're going on phase two, right?
So phase one is under construction now. It's about 23% complete. It'll be finished in 2026. With respect to the proposed alternatives, I haven't had a chance to see it, but I am familiar with the outfall extension, and Environmental Services has done an evaluation of that, and we have feasibility and costs for that. It's been evaluated, but it hasn't been pursued because it's not necessary as part of the secondary upgrade, which is what we are pursuing according to the consent decree.
Yes. But if we were to, like we said, try to modify it based on the premise of what San Diego State did, or excuse me, San Diego City did, that it was a hardship on the general populace, would EPA be open? I don't know. I'm just bringing these type of issues up because this particular project, excuse my language, reminds me of the rail.
Yeah, so the cost was considered in the negotiation of the consent decree, and that is very likely why the consent decree is such a long duration. So they essentially gave the city 25 years to do a very expensive project, and that message was, you have this time, budget for it now,
okay,
and make it happen. And so the city has done that. And the part one, which is all the force mains and gravity sewers and pump stations, all that work was completed, and it was completed less than what was originally conceived. It was about $1.4 billion, and the earlier numbers that I saw from earlier presentations were about $1.7 billion were what they were estimating those were going to cost. So it came in under budget. And the other projects we anticipate, like all our projects, to the greatest, to the extent possible, we will abide by the budget estimates or come in under them if possible. So we budget very conservatively. So the numbers that are there are considered conservative numbers.
Well, Mr. Chair, in closing, I'd like to take the phrase of the American Idol. I hope we're not pricing ourselves out of paradise. Okay, for the record, thank you. But Director Babcock, thank you very much, because I didn't expect to hear this kind of.
Yeah, no, appreciate that, Councilmember. So I saw Councilmember Tobo first earlier, and then Councilmember Okimoto just jump in after.
Thank you. Just taking a little bit from council members say, I too, totally ignorant on the whole thing, but you're saying that it would be better for us, even though we know that maybe, just maybe, saving some money, going with that option, dealing with lawsuits in the long run would be better for us? Or, so that I'm clear, because, we're looking at billions of dollars, not, okay.
Correct, yeah, so yeah, thank you, Councilmember Tobo.
Yeah, because Councilmember said, out of hardship, they were able to change the decree so that we can look at different options. So I'm just kind of, in my mind, do we keep going down that road? I know by the time, a lot of us will be out of office, and are we just kicking the can down the road so that we don't get in lawsuits, or are we really trying to save people money?
Thanks for your comments. I understand your point. One of the things I wanted to mention was the hardship, and that is addressed in the consent decree as well. It has a provision where the city can apply for an extension, not a change or modification in the requirements, but an extension of up to 5 years by making a hardship case. And it has several pages about describing what you would have to do to prove that that we can't afford it. It sets a really high bar for that, and it does give a deadline for when that needs to be submitted. And based on what's there, we so far the city has not think that we would be able to pursue that. So, as you mentioned, there are risks of trying to change course, and one of them is that there is a court order, and the stipulated penalties would accrue no matter what if we were to miss a date. Those wouldn't begin to accrue really though until we actually did miss a date, and the next date really would be is 2030. So we wouldn't really, where we'd have to issue a construction contract by that date, and then we would, if we hadn't done that yet, we would start to accrue penalties. So it would take quite a bit of effort and legal work to try and do the things that need to be done to change course at this time.
I appreciate you being transparent, and again, council members say we're just fixing a lot of the mistakes it seems, of our predecessors, or like, is this, something that we need to like be aware of? And again, I know it's not your fault, just like with rail, but man, it just sucks for the people of our city that, every time we go into neighborhood boards and we talk about any kind of increases, even if it's the littlest, and again, it's not our fault, it hits everyone in the gut. So I guess we hope and we pray that we continue to make good decisions moving forward as far as construction, and really, really listening to every alternative, because we look like we could have been saving some money, and now we just kicking the can down the road again. All right, thank you. Thank you, Chair.
Thank you, Chair. Hi, again, Director Backpacker. I had a couple of questions, and just as I thought of when we were talking about, and I don't mean to beat a dead horse, but with the Honolulu secondary treatment, you mentioned the last time that rates were raised was 2017. So was the rate increased to fund that project, the secondary treatment for the Honolulu?
Yeah, so it wouldn't have been exactly just for Honolulu. It's for the entire project. So the construction system projects and all those other projects, as well as the rest of the CIP program for the city as well. So we have a lot of other CIP work to do, and so the increase in the rates was needed for that as well. I didn't include it, but in terms of our entire CIP program, there's a lot of other work that needs to be done at the same time as these two upgrades. And Honolulu is almost done. It'll be done very shortly. It's 95% complete. Now, so that money is basically spent. The only thing left is really the Sand Island. And over the time period between now and 2035, the Sand Island project composes about a third, I don't have the number with me, but it's about a third of our entire CIP program. So the rate increases are not completely driven by this one project, but it is the largest project among everything that we do.
So that being said, so in your assessment that even though we were able to complete the Honolulu without having to do this major rate increase, that's not possible for the Sand Island.
Correct, that's not possible.
It's not possible, and the reason for that is?
Well, there just isn't enough money to be able to do the project. We have money in the bank, and money comes in every year from sewer fees, but it doesn't add up to enough without a rate increase. And so we'll be presenting that to you and showing you all the projections.
are we in the end, this is kind of tagging on to what my colleagues have said, are we going to be required to pay more on debt service on the bonds because of?
Correct, yes. So we do about, I think about half or less than half of our work is debt funded, and the rest is cash funded with sewer fees. Our consent decree projects are all totally funded by tax-free municipal sewer revenue bonds. So we will be incurring additional debt. That debt is the way we fund many CIP projects, of course, with the city, or nearly all of them, right? The DDC projects, and that does go up over time, but eventually you do pay off that debt, and when economic times are right, you refinance it, and you pay less per year, and so you don't have to come up. That's the only way that we can come up with money, not all at once, right? With in terms of having some sort of large assessment on every single person.
And I realize that this is a tough conversation to have, but I think just kind of echoing along with my colleagues, when we know that DFM is looking to instilling a $20 stormwater fee, storm drainage fee, and then we have this, I do have concerns about how this is going to impact our residents and the taxpayers when, I think a recent number was over 40% are living paycheck to paycheck, if not more. So I think this is something we have to look into, because I do have concerns that we're not going to be able to fund this properly without really taxing and putting such a huge burden on our taxpayers. But thank you for being, again, for educating us and being transparent.
Yeah, and thank you, Councilmember. We appreciate that, and we are very sensitive to that, and so is the Board of Water Supply, and we're on the same bill. So we will be putting forth all that. And just so you know, we do issue these revenue bonds pretty much every year. And one of the things that we have to do when we issue bonds is we have to go through a rating system. And they specifically look at that, at affordability, at ability to pay, and backstops in terms of how much cash you have. And so we see that analysis every year. And it shows that we are kind of in the middle in terms of our sewer fees, and there are some cities that are much more expensive than us, and then there, of course, are some that charge less for us than us, depending on their size and things like that, and as well as a proportion of the median household income. We're also kind of in the middle. There are again some cities that are a lot higher than us. Some of them are much bigger, some of them are smaller, like Los Angeles and Seattle and San Francisco. They're same size or bigger, and then some larger cities are also lesser, depending upon the local circumstances and stuff like that. So we do have all the information, and we will be,
looking
presenting
forward to that. Yeah. And I appreciate you sharing where we stand, compared to other cities. I think for us in Hawaii here, the concern is not just this one isolated fee. I mean, when you think of this, the cost of living here is astronomical in so many ways. And so I know this is something that we will continue the discussion, but thank you, Director. Thank you, Chair.
Of course. And back over to Councilmember Say.
Director Babcock, I apologize because sometimes I may be one that is contributing to the problem. And when I say this, I say it very sincerely and honestly, because we always forget about the continuum of services. Just today, the zoning committee passed out maybe 3 or 4 measures that increased the volume or the numbers of housing units, which will add on to the stress of our system, the sewer system. I just wish I had the opportunity of learning more about this earlier to talk stories like this, because at the end of the day, we're going to talk about it, but we try to address the issue. In 5 years, that's going to come. Is it 5 years? 2037. No,
sorry, 2035. So we have 12 years, a little over 12 years to get this all running and operational.
Okay, but the contract to move ahead is 5 years out, right?
Just a little bit more than that. We actually hope to award it in 29, but it's about 6 years.
So Chair Wire will be here to maybe address it, and at least you are aware, Chair Wire, because it is going to be a big issue. Could we have used some of the federal public infrastructure funds to supplant our sewer municipal bond floats?
Yeah, thanks for asking that, Council Member Say. So yes, we are definitely looking into that. There are some programs. There's a program called the WIFIA program. We're looking into that. That money is not free money. There is some free money out there available as well, and we're pursuing some of that with some. Currently, we're getting some monies for some projects through essentially from the EPA through the State Revolving Fund, and so we're looking into other sources as well. So it remains to be seen how much we could offset with some external money, but I think it's safe to say that there will be some offset, but we can't yet really say whether it would be very substantial or not.
Mr. Chair, in closing, the concern I have is the fact that we're not going to get the type of federal appropriations that we have had in the past. And it is a concern for me because then it falls upon the county to fulfill that pocket of federal and state funds that we may have not occurred, but may have received in the past. And that's why it's going to make it much more stressful on all of us. And then in closing, this is the concerns that some of the residents of the District 5 have. You know, Mr. Say, I water my yard and I only live at home by myself, but I'm paying a higher sewer fee because of the volume of water that you use. You see, somehow the optics has to change about explaining it to the general public. But how do I tell constituents in Manoa, Mo'ilili, Makali, Makiki, Pololo, St. Louis Heights, hey, you got to cut back on your volume of water so you can water your plants. And here this afternoon we had Parks asking us to water our trees, water our plants, etc. You know, I don't know what to do, but I just wanted to say thank you very much for a very honest and really open discussion. And I hope the general public is listening to what we're saying. I think all 9 members are concerned, like you. And I think for Chair Wire, yep, maybe you probably see the heavy ticket come down your way, that bill come down your way. But can I ask one more question?
Of course.
May I ask the previous speaker, Mr. Moreland?
I believe that's
Too late.
appropriate.
Is it okay, Director? Yeah. Okay.
Okay.
Mr. Moreland, Victor, do you feel that we have an opportunity if the... Oh. Don't worry. What you said?
Help me. Oh.
Oh, what you said? What? What?
I said recently.
I'm only joking,
Okay,
Mr. Moreland.
Okay.
Okay, I was just playing. But no, I just wanted to get your thoughts. Do you think we can take some of the alternatives as far as going to our state legislature? That's number one. And number two, our congressional delegation in seeing that something can be done starting this year in getting maybe the EPA to consider any modifications.
Okay, before I answer that straightforwardly, I wanted to mention something that I had forgotten when I was doing my presentation, and that is that when we met, or when the folks who met with Blangiardi,
yes,
actually gave him a list of the EPA ombudsman, the Region 9 enforcement folks, gave them phone numbers, email addresses, and so forth for them to contact them to find out what are the realities of what we've been suggesting for a good number of years, I mean several decades. We have no knowledge whether that was ever undertaken or whatever the results were if something was done.
Okay.
But as far as the legislative, we've also already made some contact with our congressional delegates So they are aware of the situation that we're talking about. Quite honestly, we do need to do an update with them. And we have had at least one change out there. So there's probably, one of the things you reminded me is we probably need to get back to them as well. We have not really approached the state legislature on any of this at this point. And that is something that anybody who can help on who would be the right folks to talk to, we'll be happy to sit down and show all of the logic as to why. And the bottom line in my mind about this is do what's right for the environment. The consequences of not doing what's right is ending up polluting our environment far more and not solving anything because we're putting money in a place that is doing no benefit for our environment in the first place. And we've got a lot of other projects, as they well know, that can be done in other locations throughout the island. And I think one of the things that needs to be thought about, and thank you for bringing up the state involved, to us, it doesn't matter who owns the land. It's a matter of understanding that all of that INA is something that's got to be taken care of by us in total. It's not something where you set up a turf war. It's looking for cooperation partners to be able to get in there and do what's right. That's really the whole issue.
Okay.
And
Mr. Moreland,
we're not seeing it from the administration at this point.
No, but I agree with you. I think for all of us as elected officials, we should all recognize we are all in one canoe.
Yeah. Thank you, Mr. Moreland.
You're absolutely right.
Yeah. Just a few quick questions for Director Babcock. I just wanted to double check. I might have missed it. So when would we be anticipated to have paid off this project? Because I think rail, when is rail paid off, 2030 or 35?
Well, so construction would continue through 2035.
Okay.
Debt would be in, it would be paid for over probably the 6 years of the construction project. So the money would need to be available at the time of invoices being received from the contract. So paid out that $2.8 billion or perhaps less would be paid out during that time period. So you'd need to develop the bond funds along the way during that time period. And then generally they have 20-year, 30-year payback maximum beyond that. Yeah, so that would be the way that debt would be paid off. And we're issuing new debt just like the city pretty much every year. So, and paying it off as you go along.
Yeah, I just wonder, because I know our credit rating was slightly adjusted. So do we anticipate this playing into that at all as we take on this size, or has that been factored into the current analysis and what happened?
Yeah, so the credit rating is factored in, and the interest rate that we would pay is factored into the financial model. We currently have a relatively high credit rating, just like the rest of the city. And we do have reserves good reserve ratios that allow us to get relatively good bond rates.
Okay, appreciate that. And last question for me, I know we're pushing time. Does one water policy, or does, say, maximizing use of wastewater affect this $3 billion amount, or no, because the infrastructure is needed in the same capacity regardless?
Yeah, good question. So One Water and integrated planning are things that we are pursuing, both of those things. And so it gets to what Mr. Moreland was mentioning, that we work together with Board of Water Supply, with DFM on stormwater, and with parks and all the other water users, as well as, and sea level rise is a big thing, or climate change is a big impact on all things water. So that's really what One Water is focused on, is really climate change impacts, which are going to have big impacts. This project, Sand Island, and our other projects are all account for climate change impacts, sea level rise, for example. So provisions are put in the structures to be able to survive into the distant future. So yeah, that is important. Thanks for mentioning that. We continue to pursue One Water. That won't change necessarily this project, because again, that's all in the consent decree. Sort of the legal document. But it can impact integrated planning. we're hoping will impact other projects that are not in consent decrees, that where you can trade different types of projects. So in other words, instead of doing a wastewater project, do a stormwater project. Currently, that wouldn't be possible with the consent decree. So we did check with the EPA and Department of Health, and they were not interested in any changes or pursuing any changes towards to the consent decree. And they made it clear that the integrated planning couldn't be used to modify the consent decree.
Modify in the sense that, I mean, is it as simple as we just achieve that 85% number you mentioned earlier? Is that qualified secondary treatment? Like, can you just mix stormwater with the wastewater, and then that's gonna bring down, right, the solids and all of that? Or is that oversimplistic? I don't know.
No, that's a good question. So no, the Clean Water Act is specifically designed to prevent dilution to achieve the requirements. So it requires secondary treatment, which is beyond primary treatment. It's generally a biological treatment, and then you have to meet the treatment objectives, including secondary process. So there aren't we kind of have to pursue the avenue that's being pursued.
Yeah. Okay, I can appreciate that. So, but for a literal act of Congress where we got to figure out how to make this work financially, and I know you're working on it, and we'll have many conversations about it. My understanding, just to recheck with Madam Clerk, we don't have any registered remote or in-person. Is it correct? We don't have any unregistered as well?
Correct.
Okay, thank you, Madam Clerk. Just to wrap up, any additional discussion? Hearing none, this concludes today's meeting. Appreciate all the presenters. Was there something, we're still in discussion, looked like you're going to add something.
Nope,
No?
just want
Okay.
to thank you for your time and thank my distinguished colleagues for their time and continuing interest in this topic.
Okay, Mahalo Director, Mr. Moreland, staff, committee members, this meeting is adjourned. Mahalo.